Human Papillomavirus, or HPV, is a common virus. It spreads through skin-to-skin contact. Many people don't even know they have it. What makes HPV so dangerous is its link to cancer. HPV infection can lead to several types of cancer. These include cervical, oral, and throat cancers. HPV is a silent threat with the potential to cause widespread suffering. The most common cancer caused by HPV is cervical cancer. This cancer affects the cervix, the lower part of the uterus. Cervical cancer is a serious health problem worldwide. Every year, hundreds of thousands of women are diagnosed with this devastating disease. Cervical cancer is a leading cause of cancer death in women. The statistics are alarming. Every 2 minutes, a woman dies from cervical cancer somewhere in the world. This translates to a devastating loss of life, with over 500,000 women succumbing to the disease annually. Tragically, the burden of cervical cancer falls disproportionately on low- and middle-income countries. These countries often lack access to essential healthcare services. These services include screening programs for early detection and treatment options for cervical cancer. Amid these grim statistics, there is a beacon of hope: the HPV vaccine. This vaccine is highly effective in preventing HPV infection. By preventing the infection, the vaccine dramatically reduces the risk of developing HPV-related cancers, including cervical cancer. The HPV vaccine is a game changer in the fight against cervical cancer. Studies have shown that it can prevent over 90% of cervical cancer cases. This makes vaccination a critical tool for protecting women's health. In a major breakthrough, the World Health Organization recently pre-qualified a single-dose HPV vaccine. This decision marks a significant step forward in expanding access to this life-saving vaccine. A single-dose schedule simplifies vaccination campaigns. It eliminates the need for multiple visits to healthcare providers. This is particularly important in low-resource settings where accessing healthcare can be challenging. The availability of single-dose HPV vaccines is expected to have a profound impact on global vaccination rates. It paves the way for reaching more girls and women with this crucial vaccine, ultimately saving countless lives. Section 5. Overcoming the barriers: vaccine supply and access. Despite the promise of the HPV vaccine, challenges remain in ensuring its widespread availability. Global vaccine supply shortages have posed a significant obstacle to expanding vaccination coverage. Production challenges have further exacerbated these shortages, making it difficult to meet the growing demand for the vaccine. However, efforts are underway to address these challenges and increase vaccine supply. The recent increase in single-dose vaccination coverage is a testament to these efforts. More countries are adopting single-dose schedules, leading to a significant increase in the number of girls vaccinated against HPV. United in the fight: funding for elimination. Recognizing the urgent need to eliminate cervical cancer, governments and organizations worldwide are stepping up their financial commitments. Nearly $600 million have been pledged to support cervical cancer elimination efforts. This funding will be instrumental in strengthening healthcare systems, improving vaccine access, and supporting research and development. These funding commitments demonstrate a global commitment to tackling cervical cancer and reducing its devastating impact on women's lives. The 90% goal: whose vaccination target? The WHO has set an ambitious target of achieving 90% HPV vaccination coverage among girls by the age of 15. This target underscores the importance of widespread vaccination in protecting future generations from HPV-related cancers. Reaching this target will require a concerted effort from governments, healthcare providers, and communities worldwide. It is a shared responsibility to ensure that all girls have access to this life-saving vaccine. Bridging the gap: infectious and chronic disease research. The fight against HPV-related cancers highlights the interconnectedness of infectious and chronic diseases. Research in infectious diseases such as HPV is crucial for understanding and preventing chronic diseases like cancer. Investing in research that bridges the gap between infectious and chronic diseases is essential for developing effective prevention and treatment strategies. A future free from HPV. HPV may be a silent threat, but it is a threat we can overcome. With continued research, increased vaccine access, and unwavering global commitment, we can envision a future free from the burden of HPV-related cancers. By working together, we can protect future generations and ensure a healthier future for all.